Welcome to Tucker Carlson tonight. It was just the other day, it feels like, in fact, it was 2 weeks ago exactly, that the Biden administration announced the suspension of private property rights in America. Building owners are prohibited from forcing their tenants to pay rent. So other people now have the right to live in your house for free. America's housing stock has been nationalized. From here on out, it's controlled by the Biden administration. But wait a second, you ask. This is America. Can that be legal? No, it's not legal. In fact, it's unconstitutional, and we know that because the Supreme Court said so clearly. But as Maxine Waters put it, who cares? What are those old judges going to do about it? What army do they control? They're not doing anything. So the Biden administration just ignored the highest court and did it. Thanks to COVID, the media have decided they can do whatever they want to do about it. What army do they control? They're not doing anything. So the Biden administration just ignored the highest court and did it. Thanks to COVID, the media have decided they can do whatever they want, and so they are. Where does that leave the rest of us, you might ask, the people who aren't in the Biden administration? Well, in a word, that leaves us exposed. Without property rights protected by a functioning legal system, American citizens have nothing at all. Everything that you thought you owned, very much including your own body, now belongs to the Democratic Party. Where you travel, who you speak to, where you live, what you say and write and think, all of this is now controlled by the party. And everything means everything, even your medical autonomy. This is funny because for decades they have told us, they have shrieked at us, that medical decisions can only be made between you and your personal physician. That is a sacred pact. Politicians have no right to tell doctors what to do. Hey, politicians, get your hands off my body. That would be the Handmaid's Tale, remember? Turns out they didn't mean it. And just to show you how much they didn't mean it, we take you now to New York City, whose mayor is not only famously incompetent, but also physically unclean. Of the 340 million Americans now living in this country, Bill de Blasio is the single last person you would ever go to for medical advice. His diet consists almost exclusively of bong hits and Pringles. There is no chance he brushes his teeth every day. Your 17-year-old stoner nephew has much better personal hygiene than he does. And yet, somehow, because Bill de Blasio still has political power due to the fact that a tiny group of people once voted for him 4 years ago, he has decided to overrule practicing physicians and force his subjects to take medicine they may or may not need, and in some cases that might hurt them, whether or not they want to take it. That's the rule. In New York City, you are no longer allowed indoors, even on private property, unless you've taken the COVID shot and carry the documents to prove that you have. That's now the law. And it's a law, by the way, that not a single person voted for, voting being part of that outmoded racist system we used to call democracy. No more. According to New York's new order, indoor spaces are off limits to the unvaccinated. How are we defining indoor spaces? Quote, indoor spaces are those that have a roof or overhang and 3 or more walls. In order to enter venues covered by the rule, you will have to show ID along with proof of vaccination. End quote. That's the law. At a press conference yesterday, Bill de Blasio displayed this graphic showing all the places you are no longer allowed to go without identification and proof of vaccination. Your papers, please. That would include restaurants, bars, cafeterias, grocery stores, bakeries, fast food places, and aquariums. Hope you're not hungry or looking to see fish because you can't go. Businesses in New York, meanwhile, are forced to hang posters explaining this mandate, and they have to do it near their entrances. They don't own their own walls anymore either. Watch Bill de Blasio explain all of this.
It's easy. All you have to do is show proof of vaccination. That could be a CDC paper card, that could be an Excelsior Pass, an NYC COVID Safe app, whatever works. All you got to do is show that proof and have ID as well.
Oh, it's totally easy. Just show your medical papers. And this applies only to COVID, by the way. No one's checking your hepatitis or HIV status. That would be terrible. But COVID, yes, it's absolutely required, or you're not allowed to eat. And all you need is proof of vaccination and an ID, a government ID. But wait a second, you may be asking, if you've lived in this country longer than, let's say, 10 days. Weren't we told that it's racist to require ID? Certainly it is for voting, but now it's not racist to require ID for people to go inside buildings in our largest city. So what does this mean for the 72% of young African Americans who are not vaccinated? They're not going to be able to go anywhere. So this policy, by the principles of equity, has disparate impact. That's the phrase they used to describe racism in action. It affects some groups more profoundly than others. And the group most affected by this is young African Americans. So how can it stand? Where's the Civil Rights Division of the Justice Department? Aren't they jumping on this? This is worse than a standardized test. Bill de Blasio didn't explain any of that. People with power no longer need to explain anymore. If you don't comply, you're going to jail. Not for looting, that's totally fine in New York, it's reparations. But failing to follow a law that no one has voted for and show your papers in a restaurant, that's something that Bill de Blasio will not accept.
And we're going to remind people that we really want people to take this seriously. Don't fool around with fake vaccination cards. By the way, it's against the law, and there are serious penalties for that.
Oh, there's serious penalties. What are you going to do to us? The same thing you did to the people who looted Macy's? Buzz off, Dumbo. So what exactly does this law say? Well, we checked the fine print because we believe in the law. And this rule does not allow for exemptions, period. Not for religious reasons, because religion is stupid. Worshipping Bill de Blasio is our new state religion. And certainly not for medical reasons, because Bill de Blasio is now your doctor, and he'll decide what's medically necessary. So we called City Hall in New York and asked, maybe we're missing something here. They told us they couldn't answer the question, but anyone who had concerns could contact the city's small business hotline for more information. So like morons, we actually did that. We followed instructions, and we talked to an operator at the hotline. And the operator told us, not surprisingly, they've been inundated with hundreds of calls from people asking the...
Shoot.
What's wrong?
I think I'm down to my last inhaler.
Don't worry, you can refill it and get it delivered using the Kaiser Permanente app.
Smart.
Refill most prescriptions online and get delivery for no cost.
Very same question. Actually did that. We followed instructions. And we talked to an operator at the hotline. And the operator told us, not surprisingly, they've been inundated with hundreds of calls from people asking the very same question. What was the answer? They didn't have an answer. Sorry, it was a mystery. Finally, this afternoon, purely because we're a news organization and they suspected maybe we'd report some of this, City Hall did get back to us and send us some guidance. Here's the guidance. They said that businesses cannot allow unvaccinated customers indoors, period, for anything, quote, beyond a quick and limited purpose. So there are no exceptions to this rule, and that would include people who've already had COVID and have high levels of protective antibodies in their system. It doesn't matter. They have to get the shot anyway. Bill de Blasio demands it. Well, is that safe? Is it safe to do that? I've had COVID. I've recovered. I've got high levels of antibodies. Not going to get COVID. Unlike a lot of people who've just been vaccinated, probably not going to get it. But you're making them get the vaccine anyway. Is that a good idea? Not a ton of research on this. That's frowned on now. But researchers at Mount Sinai Hospital have looked into it. And here's what they found. It may not be safe. It turns out that serious whole body reactions, chills, fever, joint problems, are far more common in people who've recovered from COVID and got the vaccine anyway. Is that surprising? It shouldn't be. This is exactly why we don't vaccinate people against diseases they've already recovered from. Except now. Now they must get the vaccine, even though it doesn't seem to offer a lot of protection from COVID infection, weirdly. Ask Texas Governor Greg Abbott. He's vaccinated. He's also sick with COVID right now. How'd that happen? What's going on here exactly? What is this about? We'd love to know. Unfortunately, we're long past the time when the people in power feel they have to answer even simple questions. The emphasis is on us and our total obedience. Here's the disgraced governor of New York, maybe the second to last person you'd call for medical advice, telling more than 600,000 doctors and nurses in the state that regardless of what they think about medicine, he's decided they must get the shot.
I think we need dramatic action to get control of this situation. So in New York and our state hospitals, all patient-facing healthcare workers must get vaccinated. There will be no testing option for patient-facing healthcare workers. That is a point of contact that could be a serious spreading event. And we want to make sure that those healthcare workers are vaccinated, period.
I mean, nobody has a sense of humor anymore. Getting a COVID lecture from Andrew Cuomo? The person single-handedly responsible for the highest death rate from COVID in America. Let's go ahead and put Idi Amin at the head of the Human Rights Commission next time, shall we? And then not allow anyone to laugh about it? So here you have Andrew Cuomo, who may or may not be a made member of the mafia, La Cosa Nostra, telling you that he suddenly knows more about COVID than practicing nurses and physicians. He's telling them what to do. He's giving them a medical mandate. What's interesting is that he feels he has to. What's interesting is how many of New York's healthcare workers remain unvaccinated. They don't have the information necessary to make that decision. They don't know enough about COVID. They treat COVID. And yet, as of today, more than 75% of New York's 450,000 hospital workers, as well as 74% of the adult care facility workers and 67% of the 150,000 nursing home workers have not taken the COVID vaccine. What? Why is that? Maybe before we mandate anything, we should answer that question. Why would people in the medical profession be willing to risk losing their jobs over the shot? That's a sincere question. What is the answer? Hey, Business Insider. Hey, Atlantic Magazine. Hey, New York Times. Why don't you do a story on that? And just answer the simple question. And then answer this. Why are bureaucrats with no medical expertise whatsoever, Bill de Blasio, the pothead who doesn't wash his socks? Andrew Cuomo telling nurses and physicians what drugs they must take? This is totally nuts. In June, these nurses in Houston explained their reasoning for not getting the shot.
Houston Methodist Hospital requiring all staff members to get vaccinated for COVID-19 or be fired.
Right off the bat, I pretty much decided I was not going to do it. Everybody in America should have the right to decide what they put into their body.
Jennifer Bridges has worked at Houston Methodist in Baytown more than 6 years.
Planned on staying with Methodist for the rest of my life.
She spent the last year and a half treating coronavirus patients and even got sick herself.
I just had an antibody test like a week ago. I still have antibodies in my system, but it doesn't count for them. It doesn't work.
More than 100 coworkers have joined Jennifer with this lawsuit against the hospital. It claims Methodist is forcing its employees to be human guinea pigs.
Yeah. It's kind of hard to argue with their reasoning. And if you want to argue with it, what's the argument against it? Speak slowly so we can understand. But no one wants to argue anything anymore. It's purely about obedience. It's hardly about medicine. More than 150 healthcare workers in that Houston hospital system were fired. So remember that the next time they tell you there's a healthcare shortage in this country. This is lunacy. We should not go along with it. It has nothing to do with medicine. It is a terrifying precedent that if we let solidify, we will deeply, deeply regret. This is not about COVID. This is about the existence of rational decision-making in this country and personal autonomy. Most people are going along with this because they're afraid. A few brave souls are not. Becky Paul is one of them. She's a nurse in North Carolina. She's resigned from her job in the face of forced vaccines. She joins us now. Becky Paul, thanks so much. I appreciate your coming on. I know you probably don't do a lot of TV shows, so we're grateful that you're here tonight. Tell us why you did what you did. Why did you resign from your job?
Well, first of all, Tucker, I'd like to thank you for having us on and for giving healthcare workers a voice. You know, we have so many of us, doctors, nurses, respiratory therapists, physical therapists, PAs, nurse practitioners. We're all educated healthcare professionals, and we're willing to walk away from a job. Our careers, essentially. We've worked our entire lives for these careers. And when you have that kind of conviction, you've got to ask yourself, what do they know that we don't know? So,
well, what do you know that the rest of us don't know? I mean, so this is what's so striking about it is you're a practicing nurse. You treat COVID patients. Doctors, respiratory therapists do too. No one can claim that you're uninformed or you don't believe in science. You work in science, unlike the people commenting on this. And you've decided not to take the vaccine. What should we conclude from that, Becky Paul?
Absolutely. Well, Tucker, we've been trained our entire lives to always practice with a questioning attitude. That's what we were trained as nurses. So we question doctors' orders. We question, is it the right medicine for the patient? Is it the right patient? We're the advocate for the patient. So our entire lives, this is how we've practiced our profession. And now we have this mandate that's come through, and the first thing we're going to do is question, okay, does this make sense? And none of it makes sense. None of it has made sense to any of us. First of all, where did the flu go? That was my first question when this all hit, a year and a half ago. And then, we were heroes last year, and now we're made out to be the villains if we decide that we're not going to take this vaccine. And it's just unfortunate because right now we have single moms who depend on this job for their livelihood, for their benefits. We have, I have teammates who have health issues, who they can't afford to take this vaccine. We don't know enough about this vaccine. It is experimental. It's not FDA approved. And we're going to put something in our bodies that we know nothing about. And I'm not going to run the risk of somebody tomorrow coming up and saying, oh, by the way, we made a mistake. We were wrong. Because nobody can 100% tell us right now that this is a safe vaccine. So if we're willing to walk away from our careers for that, that's a huge statement. And a lot of us, some of us can, some of us can't. So I'm here as their voice. And if I can be a voice for all of us, it just breaks my heart, some of the stories that I've heard. Nursing students who have, 2 classes left. I can't even imagine being in my nursing profession, at the end of my nursing career, of classes, and being told I can't finish my clinicals if I don't get the vaccine. Essentially, all of my hard work is for nothing. That's terrible.
Yeah. So if you're a propagandist at another news outlet and you find yourself attacking doctors and nurses because you think you know more about medicine than they do, then we've come to a really, really dark place. You should not be attacked, Becky Paul. I think you've made an entirely fair decision. It's your decision, and I'm grateful that you're willing to talk about it tonight in public. Thank you very much for coming on.
Absolutely. Thank you.
Thank you. We misspoke just a minute ago. Only 75% of healthcare workers in New York have been vaccinated. Again, healthcare workers, meaning a full quarter, have not been. And the question remains, why is that? And we hope that many more of them, not just Becky Paul, will come on this show and in other outlets and explain themselves calmly, non-politically, because it's a real question and we should have the answer before the rest of us are forced to do something that we don't want to do. Well, there are already calls tonight to move thousands of Afghan refugees